So just for context, you mentioned, you had this incident in the newsroom, and after that sort of aha moment, if you will, or that break in a pattern interrupt, you started retroactively saying, "Oh, all of these symptoms I've been suffering with for years,
Yeah.
these are actually, in the bucket of perimenopausal symptoms." Can you describe a little bit of what some of those things were? Because I think people will think perimenopause or menopause is just like irregular periods or hot flashes. Like these are
Yeah.
sort of the two like commonly known, classic textbook, like that's a perimenopausal symptom. But there's a lot of, we'll say, common and not so common symptoms of perimenopause.
Yeah, I had gone through a divorce in my early 40s. And so a lot of the stress that I was going through,
Yeah.
I thought was resulting in whatever these symptoms were. Weird things, to me, weird at the time. Irregular periods, not being able to sleep, gaining weight. I would have this feeling on my hand, like my palm, I'd be itching constantly, but nothing was actually there. My tongue would feel weird. I'd be like scratching it with my teeth, bizarre things. And what I found out later after I went backward and looked, I was like, "Oh my gosh, my hair was falling out. My hair was thinning. It was like breaking off of the ends, which made me keep getting a cut and cut and cut." And I realized, "Oh my gosh, these are all perimenopausal symptoms." You know, when we have a decrease of estrogen, when our bodies are changing, when our hormones are out of whack, that's what we're going through. And I just, there's no hormone university that you go through. And so I didn't really understand until I did some of that research of odd things, like even anxiety. I was never somebody to be anxious or fearful or scared of doing something. I would jump in, with no net. And I realized that my anxiety was at this different level, bloating, just odd things. And then when I, blamed them all on something else, I was playing whack-a-mole kind of with my symptoms. I'd go, "Oh, I've got anxiety. I'll go go to my therapist. I've got a stomach ache. I'll go to my gastroenterologist. I'll go here." We don't have time to do that. But nobody ever said to me, "Hey, you're going to be going into menopause, and those years leading up to it are perimenopause, and you're going to start seeing some differences in your body." Never, ever.
Yeah, and you said I didn't go to hormone university, and the sad reality is most doctors don't go to hormone university either.
No,
There's
they
no,
do not.
in our training, we
I
are
wish.
not. There's no, most medical professionals will say that they actually don't feel comfortable prescribing medication or managing some of the symptoms surrounding and some of those clinical textbook signs of, or that clinical, bucket of perimenopausal and menopausal symptoms, because we're just not trained. Like there's no training for it. And even, I'm a doctor of chiropractic, and we didn't get it either. We don't get it either. And of course, when you are a body worker, I remember, maybe it's like 15 years into practice, I started asking women where they were in their menstrual cycle. And that would direct my treatment because they were more or less susceptible. We know that ligaments change their laxity based on how much estrogen is around, what kind of treatments what we were doing that day in clinic. And so I would say that most healthcare providers, irrespective of the letters behind their name, we're not really getting anything unless you're taking specialized training after your
Mhm,
degree.
mhm.
And this is why your work is so important, because it's no longer acceptable for patients to just delegate all of their healthcare to their provider, thinking that the provider knows everything, because the provider doesn't. So there
No,
has
I
to be this
know.
dialogue between the patient and the doctor that is open, honest, and conducive to
Mhm,
affecting the change that they're looking
mhm.
for. Yeah.
It's so important, and I think that was one of the big parts. People always ask, like, "What was the most surprising thing with doing the documentary and the book?" And I think it was the fact that we still have to tell women to advocate for themselves. Like
Yeah.
it's the onus is on us right now until there's another, until we are all educated on this or all feel comfortable with it, or we have, you know, schools, medical schools that are really teaching this as part of a curriculum.
Right.
So I think it's important for women to understand that and not feel like they're going to go into a doctor and whatever answer they get is the right answer. And I think that it's unfortunate because it's hard as a woman to like it's so hard to get to one doctor's appointment, more or less, more than that. It's hard if you don't have access to do that. It's hard if your insurance is not, it's going to accept from here to here to here or doesn't pay for hormones. There's so many obstacles, I think, that we put in the way of women and then say,
Yeah.
figure all that out and then, and then be happy at the same time doing it, or be successful in your career, or, make sure that your relationships are perfect. So I think that it's hard. And so I think part of, what I want to do in advocacy work is making sure that we're educating on all those levels and then giving women help where they need it.
Beautiful.